Well, hello. I am Delaware State Representative Paul Baumbach. I serve the 23rd House District, which is the west and north side of Newark, up in Corner Ketch. And it is Sunday the 24th around 4 p.m. And I'm giving an update, providing this Facebook Live to talk about the current and upcoming actions of the Delaware's Retiree Health Benefits Advisory Subcommittee, which I serve as a co-vice chair. And the subcommittee was formed in January by Senate Bill 29 to study the choices available to the state for future health benefits for Delaware state retirees, state employees who have retired, and to give recommendations to the General Assembly, to the governor, and indirectly to the State Employee Benefit Committee, the SEBC. That Retiree Health Benefits Advisory Committee, sometimes called the RHBAS, just to keep all the initials lots of fun. And what am I going? That's what I'm going for. Let's see if we can do that one. Okay, and okay. So with that, I'm going to bring some stuff up on the screen. Okay, so number one, if somebody can please send a comment indicating whether you can hear me, that would let me know that my technology is working. And so I want to start off with the agenda. We've got a meeting on Monday afternoon at 1 o'clock. So with that, I will bring up our agenda. And let's see if we can make it a little bit bigger. So 1 to 3 o'clock on Monday down in Dover. You can join by Zoom. And you've got all the information here. This is all from a website. And if you search on, thanks, Roger. I'm going to put up, let's get this. So I'm going to link in, I'm going to comment a web page that you can click, and that will give you the materials for the State Employee Benefit Committee, including its subcommittees, including the RHBAS. And when you click on the RHBAS and you go way down, you'll see the June 26th meeting. Click on that, you'll see the materials, including the 3 that I'll be showing you today. The first one is the agenda. So this is how to connect to it. You can just view it. You can also, there's a process where you can raise your hand and offer public comment. But let's go down a little bit and see what the agenda is. Call to order introductions, review and approve the minutes. Then we've got a few different, we want to discuss the modeling impacts. We'll look at some handouts for that. Look at what we plan to do in the future, have a discussion amongst the subcommittee, and then we go to public comment, and then we adjourn. Again, and it says down bottom, it should say down maybe up top. If you wish to, materials are there in advance. If you wish to submit public comment, it looks like, okay, so you can click on this hot link and it will show you, let's see if it does, how to submit public comment. And that includes, you send it to sebc@delaware.gov. And if you get that in, by tomorrow night, Sunday night, I believe it'll be available to be read at the committee on Monday between 1 and 3. So, and it'll also be available in the record. But again, you can also tune in through Zoom and you can raise your hand. And as long as we have time, and generally we do, you have an opportunity for public comment. So that's the setup there. So let's look over the materials. All the stuff was posted yesterday. I forget what time it got posted, but it was posted on Friday for Monday's meeting. It's a little bit delayed, but the reason it's delayed is we want to get as complete information as we can and still get it out at least one business day before the meeting. So we did some last minute additions, and these are the next materials. So this first one is one that talks about what are nearby states doing, and I think it's probably me. And it notes, I think, the top here that a subcommittee member, I think that's me, asked for what are surrounding states doing, because I should go back to ground zero. Why are we here? Why do we have this committee? The state has promised retirement benefits, has implied a promise of retirement benefits to its state employees for decades. We've defined what we've through our practice have led people to believe what they understand it to be. But we've really not set money aside to build up to ensure that they remain, that they're funded. So well, at this point, because of accounting rule changes, how much we are behind has become painfully clear. So we are tasked with finding ways to build up the backing for these promises. So we've got three populations. We've got current employees, and then we've got retirees who aren't yet eligible for Medicare, pre-Medicare retirees, and then we've got Medicare eligible retirees. One of the things we note is that we have fairly expensive costs for our non-Medicare retirees. So if you retire at 60 in 5 years till you get Medicare, for those first 5 years before Medicare kicks in, we're paying a lot, and the retiree doesn't pay that much. So I said, well, what are other states doing? And the folks helping us out in the subcommittee reviewed the three surrounding states, Maryland, Pennsylvania, and New Jersey. And we've got three different sets of things. What you can see in Maryland is that there is they do the same thing we do. They make the same medical plans that are available for employees, available to the pre-Medicare retirees. So you can choose a PPO, an HMO, et cetera. And there's different costs depending on which one you choose, different monthly costs. But there's a share that's paid by the retiree. Also notice there's the issue of when are you eligible for that? And in Maryland, it does depend whether you're a teacher. So they have different programs depending on what you've done for the state as being a state employee. So teachers have their own roles in there. And what you can see is that it's not just once you have 10 years, you get it. It's 10 years in 10 years of service, but also usually a level of age. And what they note that generally you're within 5 years of normal retirement age. You're at least 60 by the time you retire, and you have at least 10 years of service. We don't have anything that limits you based on age. If you've got 25 years of service and you may be 45, then you're eligible to both get a pension and retiree health benefits. It seemed that that's unusual, but I wanted to see, and so I asked if they could look into the three surrounding states. So that little piece is different than Maryland. If you come down to New Jersey, what you can see on this far right is, again, you need to be within normal retirement age range of 60 years or older. And then there is a share cost that the retiree has to pay. So it's not all paid by the state. And it looks like it's based on your retirement allowance. Another one is based on your final year salary. As you can see, the retired, again, New Jersey treats its retired school employees different from its retired non-school state employees. And how much is paid differs from one group to the other. And then if you go to Pennsylvania, what you see is a few things. Again, it's a similar thing. Different plans are available. How much is paid by the retired employee is based on what their final salary was, a percentage of that, a little difference for the school employees. And again, as far as when people are eligible for this, this is a combination of years of service and age, but it is one that in order to retire without, well, it depends on what year you retire. So they change things over time. When you retire at 50, different rules than if you're 65 when you retire. So this reinforces the suspicion that what we have in Delaware is it's more generous than our three surrounding states as far as we don't have rules that you have to be a certain age to retire. It's years of service is what matters. And if you're eligible for the pension, then you're eligible for retiree health benefits in Delaware as a state employee. And that is, again, a little different from our surrounding states. Let's sort of put a pin in this, and we'll get back to this because it has to do with the category of changes that we could consider in the category being eligibility. So we'll come back to eligibility. These are the websites that you go to for it to find out more. This is where they went to get the information to fill in these previous pages. So that's the second attachment. The third one is the main attachment. Sorry, let's go up top. So this is the main presentation for Monday's meeting. And what we looked at and what we saw at the early June meeting was a big aha and a little bit of a negative surprise. No, a big negative surprise. this baseline line, which indicates how we're doing without changing anything. We have, our promises are this big, our savings is this big. Well, this says that if we change nothing, one of the things we add regularly to the quote OPEB, that stands for Other Post-Employment Benefits, into the OPEB fund is this 0.36% of payroll. So every year we pay out $1 billion, whatever it happens to be, and 0.36% of that goes into the OPEB fund. If we just continue that and change nothing else, we'll have about 18% of what we need 30 years from now. So that baseline is important, because we had looked at this. Well, what if we put 1% of the budget aside every year into the OPEB fund, and we saw that we could get 60% of the way there? I said, hey, that's wonderful. Thinking that was from 0 to 60. It's not 0 to 60. It's from 18% to 16% to 60%. So it's a 42% addition to where we already are. That's not a terrible game changer on this slide, but on the next slide is really major. But this takeaway is we're already 18% there. If we do the 1% funding, we'll talk about that in a bit, then that plus where we already are will bring us to about 60%. We can do more if we put more than 1% of the budget annually towards it. But for now, the subcommittee a month or two ago recommended that we do this 1% step, and that's working through the legislature this month, and that coupled with where we start should get us 60% of the way there. Good, not yet great, but 60% is good. So let's move on that. So this is the funding option category. The next option, as I mentioned, is eligibility changes. There's 4 types of eligibility changes we've looked at. One is having a higher share the retiree has to pay to cover their spouse, a spouse of a retiree, a spouse who is not themselves a retired state employee. And this says that we would increase so that the retiree has to pay half of the cost of that Medigap. This is well, actually for both future non-Medicare and Medicare, whatever that cost of the benefit is, the retiree is responsible for generally 5% of their own cost, and then 50% of their spouse's cost. And what would that bring us in? Well, it depends on how this applies, how we grandfather it in. I guess I can see this. If this is only for people who are retire after 2024, after next year, then that will bring us to 19.5%. We thought that was, hey, 1/5 of the way there. Well, that's just 1.7% ahead of where we start. So we thought we were getting high teens benefit from each of these eligibility possibilities. And instead what we found is we're getting up to 3% and no more than 3% from any of these things. So the one that gets us the furthest along is if we say anyone who retires after next year will have to pay 50% of the premium for their spouse, their healthcare premium for their spouse. That will add 1.7% of our path getting to near 100% of coverage of the dollars we need for it. And all of these, again, the max is 3%, are a lot lower than we were thinking. We were thinking we were getting 15 to 20% improvement from any one of these. Indeed, what instead we're getting is between 0.7 and 3.0%. So big disappointment here. These are things that will make employment less attractive for current and new employees, but it doesn't. None of these things changes a situation for any current retiree. So let me stress that. Actually, nothing here changes anything for anyone who is retired or retires by the end of next year. Now, there's also different hire date scenarios where this only affects people who haven't even been hired yet. Those who are hired after next year, or those who have less than 10 years in, who were hired after January 1st of 2015. Those are the 3 scenarios within each of these 4 categories. And you can see, again, between 0.7 and 3% improvement for any one of these changes, depending on which scenario. I will point out this bottom one, increase minimum retirement age, so that you have to be at least 60 to get health benefits, or 55 if you're a retired police officer. That gets us about 1.5%, almost regardless of how you grandfather it in. And one important factor I want to share is that The state did a survey of all of its current employees and had a reasonable response rate. I will say the survey was relatively challenging to understand and complete, but they did it. And one of the takeaways from it was that the proposed change, which upset the fewest people, was this last one. This increase minimum retirement age for health benefits up to 60 or 55 if you're law enforcement. And that gets you about 1.5%. But I mean, you put all these together and maybe you agree to 2 of the 4, you're going to come up with less than a 5% difference. So compare that to the previous slide where you're making 42% benefit from doing one of these steps. These guys, this is 1/10 the impact, even if you do more than one. But our subcommittee on Monday is going to be discussing them and saying, okay, we now know the relatively small impact that any of these are going to make. It's still billions of dollars, but it's still a small impact. How is that, or any of those justified in order to cut back some of the, I'm going to say generosity. I'm sure there's a better word, but today I'm just going to say generosity of some of these elements, these eligibility elements. I look at it, I do think that minimum requirement age, not having any limits to it, is unduly generous, especially we've verified that this is unique amongst our 3 surrounding states. I would be very open to something down here. We'll see how the subcommittee talks. It's also one where we can treat different populations differently. Retired law enforcement one way, retired school employees another way. Whatever you have to do to, I'll say, stay competitive to our neighboring states, I think is reasonable. I know it's only getting 1.5% from this, maybe less if we have different subpopulations that we clamp down a little bit more than others. But 1.5% is not all that much, but I think it's responsible to get a little bit more reasonable about covering retiree health benefits, waiting until someone at least is 55 before you get the state pays all your almost all your health benefits. That's the eligibility changes. So we'll be talking about what do we like here. This is essentially sort of a menu. What do we think we want to do or choose from this menu? And then the last one is benefit design. And this is going to be several slides. Please don't be upset about some of the things that are being looked at here, because our subcommittee is asked to look at everything, including things that we've heard very clearly that a lot of retirees don't like. Also remember that everything here is being modeled to not change a thing for current retirees. Okay? Does not change anything for current retirees. What the state proposed doing last year was changing things for current retirees. This is not. That's off the table. We're not looking at that. Okay? So breathe. Okay? If you're a current retiree, no changes. Okay? What is being considered for others, for people who haven't retired yet? Well, one is this health reimbursement account, HRA. And I'm going to bring up that thing. So from, I think, 2 weeks ago, this slide was presented. It actually was presented to the Retirement Benefit Study Committee back in 2021. And this shows that this is modeling like a 2% annual growth in a health reimbursement account. Generally, your health costs grow with age. So what this is designed to do is have this. Let me see what the categories are. The costs are lower because you're healthier at 65 than you are at 85. You have some out-of-pocket costs, and the HRA, the health reimbursement account, is funded about $5,000 a year and add 2% a year. So you have a little excess that builds it up, and then each year it keeps building up until your costs start exceeding what the HRA contribution is each year, and that happens right around age 79. And then you start spending some of the built-up HRA balance, and what you see is that you sort of run through it by 86, 87. And then you're out of pocket more costs because you have no money in your HRA. And what is being added each year to your HRA is less than your premiums, the cost of it. This is, and keep in mind, this is for the average. And we've seen before when they gave us averages, we said, well, show us the healthiest 10% projection and then the least healthy 10%. And what you see is that it's much better for those who are very healthy and much worse, as in it runs out of money much earlier if you've got some chronic serious medical issues. So we looked at this and said 2% doesn't really impress us too much. So can you run it with 4% also? What we found is if we do 2%, which again, many of us don't like because it hurts those who have a worse health situation than most, it will get you an extra 10% or so, depending on how you phase it in. But if you do it at 4%, which is a way to be more reasonable given the rising cost of healthcare, what you see is it doesn't save a penny. And actually it costs money in some cases. So, to have it not be, it's too harsh to say, I'm going to use the word anyway, harmful to future retirees, you need to do it at 4%, which doesn't save a thing. So I look at this and say, I'm not a big fan of a 2%, and a 4% doesn't do anything. So I'm off the HRA bandwagon. Let me see, Roger saying. Suggestions for modeling, submitting this by email. Oh, good. General Assembly indicates that 1.75 the current budget be applied to cover state employees, spouse, healthcare, equivalent, so scripted. All state Medicare age retirees and their spouse who qualify for full healthcare pay 7% of the previous 3-year average actual cost. I'm going to need to look at that in more detail. It's not showing up my screen. It cuts off after a piece of that. Roger, I'm going to get to that a bit after I finish going through this presentations, the slides that we'll be looking at. So what are some more? That was the first benefit design change slide. Let's go to the second one. Here we're going to get to that. Let me see. Medigap supplement, supplement plan to existing. So this is still staying with the current Medigap. You can think Medicfill is the current version of the Medigap that Delaware has customized and uses. And what it says is that currently retirees who've retired after, I think, 2012 pay 5% of the premium. Those who retired beforehand don't pay any of the premium. And that we would raise that at some point in the future to 10% from 5%. And what you see is that adds less than 1% to the funding level. So is it beneficial? Yes. Does it change much? Not really. So that's one thing they looked at, and they said, well, what if we change it instead of paying from going 5 to 10%, what about 5 to 15%? There you're getting 1.5% or so improved funding by having retirees, future retirees, pay a greater share of the cost. And that is something that I think we saw, actually we didn't see. The slides on the other states only looked at pre-retiree. This is all, pre-Medicare. This is all Medicare eligible retirees. So it doesn't, we have not seen today what the surrounding states do as far as sharing the premium costs with Medicare age retirees. But these changes, if we did it from 5 to 10 or 5 to 15, either get up to 0.7% or 1.5% improvement if we boost that a little bit. So that's the second benefit designs option. Okay, now here comes the ones that you're not going to like. So sorry, I don't want to jump to that conclusion. You may not like. Let's make it bigger. I think that's a little bit better. So again, our base rate is 17.8. These things get us 5 to 7.5% improvement of the funding. What does it do? This says we're going to have a Medicare Advantage and offer it, and it's one where everything stays at 5% for retirees 20 years of service. This is one where, and this is not offer Medicare Advantage plan similar. I believe that this is one where we continue Medicfill for current retirees, and then either people who retire after 2024, or people who are hired after 2024, or those who've been hired only the past 8 years or so. When they retire, then they would get Medicare Advantage instead of the Medigap that we have, the version we call Medicfill. And that would save some. That would save in the 5 to 8% range. It does not affect current retirees. So, good to know. But I think in our discussions, I think it's pretty clear that most people prefer, if Medicare Advantage is on the table, that it be a choice and not a forced lack of choice. So let's go to the next slide. But we know Medicare Advantage only for future retirees can get us, in the 5 to 8% improved funding ratio. Next one, lots of pages here. Other funding options. So now we're not plan design. Now we're looking at funding. Remember, one of the things we're doing is 1% of the budget goes in. Okay, so this says we're currently putting, remember the baseline, we're putting 0.36% of payroll, not of the budget, but of payroll, into the OPEB fund. What if we were to increase that by about a factor of 3 up to a full 1%? That'll get us 7.7%. Remember, we're at 60% with the 1% of budget. If we also boost this rate of payroll percent from 0.36 to 1%, we get to 60%. This will get us more like 67% or so. That's not bad. And if we maybe get it doubled even more, so go up to say 1.7%, then we probably going to be pretty close to 75%. And that's not bad at all. That's actually close to to me, acceptable finish line. So this is new. And the delta, how much additional over the baseline it provides, is a nice big number that I like seeing, number 7.7% improvement. So I like this. So let's explore this a little bit more. I'm going to come back to, oh God. Okay, so sorry, we're going to put a pin on this and we're going to come back to this kind of funding option in a bit. Frankly, it should have been an earlier slide now that I think about it, but we're going to remember this, bringing the state share of payroll from 0.36% to 1%. I think it's really attractive and I want to know more about that. I think we'll be talking more about it on Monday and we will come back to it today. So what are other ways? So let's look at, here's combinations. We've been talking about, well, what if we do, the budget increase and we change when you're eligible for health benefits to 55 or 60 years of age? And what if we make one plan design? So what if we take something from funding, something from eligibility, something from plan design, and put them together? What do they do? So this says, well, let's say we have a choice between MedicFill, a Medigap plan, and a Medicare Advantage. And actually, so this is the one, again, we give options. I know early in this whole saga, I'm going to say in the September timeframe, when people were first really learning about Medicare Advantage, and they're like, I don't like that, having to get pre-authorization. I don't like having to be in the network. Can I just have the existing plan and maybe I'll even pay for some of the difference of that? That's what this is based off of, is that feedback that the state got way before the lawsuit, before the stay order from the judge, and said, well, what if we offer both? And then what else do we do with it? Well, if you're already retired, then you get MedicFill for that, the normal either 0 or 5% of it. But if you retire later, let's say if you retire after 2024, then you have to pay 15% to keep the Medigap version, the MedicFill thing. Or if you want Medicare Advantage, you just have to keep paying 5%. So you have to pay an extra 10% of the cost to be able to use a MedicFill as opposed to a less expensive for you Medicare Advantage. Gives a choice, gives you an economic incentive to choose the Medicare Advantage. Interesting. It's certainly what was discussed as being more attractive than what was proposed back in September. And what does that do? It gives you a delta of about 2%. So having a choice and increasing the share to keep a Medigap for the employees where that's really important, and having it stay the same price for those who are comfortable with Medicare Advantage. That together came up with about a 2% improvement to things. So interesting to actually combine a benefit. It's a plan design difference that takes into an eligibility issue, because the cost changes depending on how when you retire. So interesting plan design change in here. Let's see what else we have here. So this is the one. Another combination of that is what if we again have the current Medigap? We're going to call it. We currently call our version MedicFill, and let's say we add a Medicare Advantage choice. And depending on how many years in or how old you are at the point we make this change, you'll pay 25% of the difference you'll pay 5% of the premium if you want to keep MedicFill, or you'll pay 25% of the premium if you haven't retired yet and you retire in the next 5 years. You'll pay 50% of the difference if you're 10 years from retirement, and you'll pay 75% if you're 15 to 20 years, and eventually you pay all the difference if you want to keep a Medigap as opposed to a Medicare Advantage. So it's a staggered 5% to 100% of the premium if you want to get a Medigap, have a Medigap when you retire, and you can always get Medicare Advantage for the existing 5% share. This is only for new retirees. This is only for those who retire after 2024. No changes for current retirees. What does that do? Remember, the last one was 2%. It's a 5% difference. Interesting. And so this is something that we're looking at. I think it's new. I know it's new. So I'm not sure if the subcommittee is going to feel like they can digest this enough to make a determination on it. But I think it's a different way of looking at having the choice of a traditional Medigap and then a Medicare Advantage, and then having a dollar difference to the future retirees for that. So another one's out there. Now, where is my cursor? It must be there someplace. So here we go with the combinations. Okay, so let's say we started that baseline of 17.8%. What if we add 1% of the budget, as we're doing now? We'll look at that a little deeper. Then let's say we do an eligibility change. So we say, well, you have to pay 50% of the premium for your spouse if you retire after 2024. And then let's say that we have a choice of having access to a Medigap supplement and offer a Medicare supplement similar to existing special MedicFill. So that's really no real change in there. But we up the share from 5% to 10% of the premium for those for future retirees. So we take those all together. We know that just the 1% itself gets you to 60%. This brings you to a 64%. So we're getting closer. I think 75% is a good goal. 80% is great. I think 75% is pretty darn good. So this gets us up to 64% by adding that spouse share at 50%, and then future retirees share up to 10% from the current 5%. It gets us further along. So this is an example of a combination, and this is what we're asking the subcommittee to help us identify a limited number of combinations. We have a total of probably 20 different elements. Every combination would probably be around 1,000. We're not going to run 1,000 combinations. We're looking to the subcommittee to say, give us 6 combinations of what if we do this thing in funding, or these maybe 2 different things in funding. That's maybe 1 or 2 things in eligibility, maybe 1 or 2 things in plan design. 2, 2, and 2 means there's 8 combinations of what if we do the first one and the first one and the first one, first one, the second one, et cetera, et cetera. 8 combinations. Run these combinations. It'll take some weeks, but let's get a limited number of combinations to put together. Here's an example of how you put it together. This is not a recommended combination. This is an example combination. So with that, the hope and plan is we're discussing the data we have now, and then selecting, guiding on what we want to see in the future. I personally would like to see on Monday us also rule some things out of we do not see any path where we would like this element or this element, which will also help us narrow down the models we want. And then 2 weeks out on July 10th, we'll start, as we get some answers where some combinations are modeled, we'll start seeing how the impact is, and we say, I think that's going to hurt too many people for how little it closes the gap, or that closes the gap pretty well. And I think what we're asking to cut back on future retirees is pretty reasonable. So we'll be looking at the results and then talking about them and saying, let's keep that one in consideration. Let's rule that one out. And we're going to do essentially the same thing on the 20th. 10 days later, looking at more combination results, discussing them. And then also we want to have some extra public comment time on the 20th. And maybe by the 10th, we really have it maybe down to 3 different combinations. And let's have a vote and see if we can settle on one. That will drive a draft report. We want, again, public comment on all of these meetings, but especially we would have a draft report presented ahead of the August 24th, have some public comment, and I think as we did for the previous draft report, have public comment before we finally vote on the draft report in that meeting. And then if we may still be working in September, our hope is to finish this part because we'd like to get the report in by September 1st, because we think the SABC is going to, would like to be creating its request for proposal for whatever kind of plans they want, with our guidance, hopefully, respecting as many of our recommendations as they can. They want to do that in September, put it out, say October 1st, have insurance companies have maybe 2 months to put their bids in, get them in December. SABC can start reviewing them December and January, and then try to get to the fine print. And I think they're aiming for getting this, getting everything chosen in the March, April of next year timeframe, and then start preparing the communication starting in June, having the enrollment in October, November, and have everything start January of 2025. It's the timeline we're looking at. This does assume that there is some resolution to the court case. Don't know about that. That's a different branch. So that's in other hands right now. But hopefully that will be resolved so that the SCBC can proceed with identifying what the next retiree health benefit plan is, hopefully well informed by the work of our subcommittee. What else is in this presentation? And I mentioned I said we're going to put a pin in something. So this is that OEC, other employment costs. This looks at for a typical employee with $50,000 salary. Let's really focus on this percent. We currently put 0.36% towards pre-funding health, towards OPEB. And one of the models we looked at said, well, what if we change that to 1%? Really what it's talking about is, what if we swap these two? What if we said, you know what, post-retirement, whatever the heck that is, and frankly, for our discussion right now, don't need to know about it. What if we cut that to 0.36% and then boosted OPEB to 1%? If that doesn't screw things up for a post-retirement increase, then that we know helps around 7%, 7.7%. Kind of neat. And if it does that much, maybe there's some savings in some of these other rows in the future that can have OPEB rise above 1%. And if it gets up to, I think, 1.7%, we should be getting close to 15% benefit from that. 15 plus the 60 that we get from the 1% of budget gets us to 75%. I start breathing easier. So we're going to talk about the OEC, the other employment costs, and what our flexibility and what our current and future is. Are we able to swap these two? And are there any future things we can do? We'll be talking. I expect that we'll be talking about that on Monday. What is this? So this is the whole thing. Sorry, remember that fairly complicated. What if we have a current Medigap like Medicfill, and let's say we offer a Medicare Advantage similar to what was proposed last year, and the current retirees can have either of them for 5% of the cost. But if you're a new retiree retiring in 5 years, you have to pay 25% of the difference if you'd like to keep the Medicfill, and otherwise you can get the Medicare Advantage for the 5% level. And then future retiree, 5 years out from there, if you retire 10 years from now, you have to pay 50% of the difference. You always have access to a Medigap. You always have access to Medicare Advantage. If you want Medigap and you're not a current retiree, or you retire after 2024, you would have a growing share that you'd have to pay for the difference in cost between the two. So that's the this gives you more. What are the dollars? What are we talking about? Current retirees pay around $23 a month for the current Medicfill, the Medigap thing. And then in the future, if they wanted Medigap, they'd have it for that same 5%, roughly $23 a month. Or they could also choose Medicare Advantage for, again, that same $23 a month. And then, but a future retiree for the coming from retires between 2025 and 2029, they pay about $132 to have a Medicare Medigap program, or they pay the same $22.96 if they wanted to have instead a Medicare Advantage. So it gives them choice, but they have to pay for the choice, and how much you pay grows for future retirees. This just gives you some hard numbers to compare, and that is the last slide there. Already did that part, so now I want to hopefully go there. Let's go to, where are we going to start? No. I want to go, do I have it here? Not there. Okay, well, I don't have it there. Okay, so let's go here instead. So in early May, the RHBAS recommended recommended that the General Assembly and the governor commit to 1% of the budget. This is something that Governor Carney began recommending in the current fiscal year that ends next Friday on June 30th. So from last July 1st to this June 30th, he had it in his budget. In his proposed budget for next year, he had it in there also, and the legislature incorporated it in the budget that the House voted on last week. And this says we're not going to base it on the kindness of a governor or a legislature. Let's put it in the code where it's the default. You got to put 1% of the budget every year into it. So we have this bill, Senate Bill 175. The four elected officials in here, members of the legislature, are the four members from the RHBAS. Been involved with these meetings twice a month since the dawn of time, or more accurately, March. So it takes care of it. And how it does it is hard, generally interesting to read, but the main thing is here, at least 1% of the grand total of the general fund operating budget goes into the OPEB fund. Everything else is just sort of details, and then there's reports and stuff. But this bill does it. What is this one? What's it do? It costs 50 to 56. It's going to grow as the budget grows. 51 million for the next fiscal year, expect to be maybe 56 million the year after that, and it just keeps growing as the budget grows. And that is why it's able to help narrow that gap from about 18% to 60% by doing this over 30 years. So the bill has passed the Senate, and it currently sits in the House Administration Committee. It cleared the Senate unanimously. I am hopeful that it passes without, that it clears the House Administration Committee early this week, and that we vote on it in the House, say by Thursday, get it to the governor's desk. We really don't need to hurry on this because it really doesn't need to take effect until January, when the governor submits his recommended budget to the legislature. But I think it is important to get it in this calendar year, which means by June 30th for the legislature. So that's 175. Now, is there a chance that I can read Roger's comment here? Let's see. I'm going to go to my phone and see if there's a way to see it there. That didn't do it. Okay. That's not what I want. Post. I am not seeing it. Okay, Roger, I'm going to tell you what I see. Show. Oh, here we go. Look at this. I see it's cut off there, Roger. I'm sorry. If you're able to post the rest, that'd be great. Okay. General Assembly legislates that 1.75% of the current budget be applied to cover state retiree and spouses healthcare, Medicare, or equivalent in silver scripts. Cover state retiree and spouses healthcare. Okay. All state Medicare age retirees and their spouses who qualify for full health benefits pay 7% of the previous 3-year average actual cost per. I think what you're talking about here is how the, let's see how we call this. So the SCDC does all benefits, including health benefits. They treat the three populations of current employees, pre-Medicare retirees, and Medicare eligible retirees fairly similarly, even though the costs are very different across the three populations. So I think what you're saying is, I think you're pointing to one of the observations, which is that Medicare eligible retirees, because Medicare is paying largely 80% of their costs, the cost to the state for them, at least while they're in their earlier retirement years, say 65 to 75 or so, is lower than it is for, say, a 60 to 65-year-old retiree where Medicare is not paying a penny. And we want to try to get it rationalized between that. I assume that's where you're going. I wish I had the full comment in there, but it sounds like you're sending it in and we'll be able to look at it, Roger. It's I agree. I think that the SCBC, not that I've ever served on the SCBC, my sense is that the SCBC is certainly considering changing its habit of treating them as one population or similarly to one population when they were three very distinct populations. So we'll see about that. I know we don't have too many people and too many comments on here. Really what I want to focus on, let's see if I get that out. I don't know how to do that. I don't need to do something here. Hi, there we go. Okay. So what I think the subcommittee is going to be looking at, obviously all those handouts and stuff. Funding, I think our base is 1%, and that's probably all we're going to be looking at now. We may have a recommendation that the legislature consider moving to 1.5% or 2% if it feels it's not making enough headway towards the funding and the projections in the next 5 years. Let's try to adjust course before we're too far along. So I think that's worth keeping the door open, but we've already said we'd like the 1% as a start. So I don't think we're going to do much there. Eligibility, there's 4 different elements. I think that in the subcommittee, we're going to talk and figure out, do we have interest in making some restrictions in the eligibility for future retirees, and which future retirees and which restrictions would we be open to? Is it also something we might change from one population to another, say retired teachers versus other state employees, those who are under collective bargaining? We can have different treatment, different eligibility rules for the different subpopulations, and that may make it frankly easier to pass as a bill if it's legislation. We're mindful of, there's things we can say, I'm a numbers geek, it makes sense on numbers. That doesn't mean that politically it's possible. We need to make sure we have something that that people accept as being fair. So that's why we have these public meetings and we're talking about it, and we share how we're coming about our thoughts and leanings, and we need to figure out what we think meets that standard of fair and effective in addressing the problem number 1, which is getting the funding for the promises. And then the other thing is the plan design. And the plan design, as far as, do we offer Medicare Advantage as an option? I don't have a problem with that. Do we charge for people to have a Medigap when and not charge anything extra if they have Medicare Advantage, but charge them more for Medigap? Frankly, I was certainly open to that back in September, but the world's changed since then. So I think we're going to be discussing that on Monday. I'm certainly open to it. How much should we charge for the difference? Stagger it the way that one example laid out. Maybe it doesn't make a major move along there, but it has some benefits. So I think that's worthwhile to keep considering. Maybe it's something that we have a less steep rise in how much of the difference the future retiree would have to pay. Don't know. I'm very excited about the possibility of the OEC, the other employment cost, the 0.36% of payroll, rising to 1%, and very excited about it rising past 1%, because I think that and the 1% of budget, those two together can get us, I think, up to about 75%. So I think that 75% and then just a few little tweaks here and there can get us another 5%, get us to 80%. Mission accomplished. I think that would be a very good outcome. But at this point, we've got a meeting on Monday from 1 to 3, and we'll be hearing from subcommittee members amongst ourselves, talking about it, figuring out what they like, what they don't like, finding out what more information we like, finding out what combinations we'd like to have modeled, and then we're going to hear from the public, and then we've got a meeting 2 weeks out. So that's the game plan. We've got Senate Bill 175. There's another bill from Representative Carson to, I think, add legislators to the SEBC. We only have, I'll say, 2.5 legislative days left, Tuesday, Thursday, and a little bit of Friday. I'm not expecting to go all the way through this week. Doesn't mean that it won't go through one chamber, go through the House this year, and then the Senate consider it next year. And it could go through both chambers for all I know by June 30th of this year. We'll see. But that's what's happening legislatively. But I think the main things we're trying to get the recommendations from our subcommittee to the SEBC by the end of August. And I think we've got a good game plan. So I think Monday's meeting is going to be really powerful, is a little bit overstating it. But I think it's going to be, I think we're going to get a lot done. I think we're going to make a lot of forward progress. It's not that we've been spinning our wheels, but we've been doing so much prep work over the past 4 or 5 months. I think we're going to be making some decisions. I think we're going to be making some measurable progress on narrowing what we're considering and getting clearer what our destination will be. So I'm kind of excited about Monday's meeting. Unfortunately, I can't be there in person. I'll be Zooming in. But if there's only one meeting you catch Monday's meeting from 1 to 3. It would be my suggestion. Again, the website for the materials includes the agenda, which has the sign-on information is right up there. Please consider joining if you'd like. Please remember that I do post this on YouTube for those who don't use Facebook. And so I'll be posting it there. And obviously you're on Facebook, so you can share that with them once I post the YouTube link. With that, I'm not seeing any further questions. And so I think I'm going to just tune out. But I really appreciate your time, your patience, your engagement here. And hopefully the next update will be a little clearer as far as the path we are on. So please have a good rest of your weekend. And perhaps I will see you on Monday. Take care.